My name is Elizabeth Hillman. I'm a senior at the University of Notre Dame, and I study Spanish, pre-medicine, and Catholic social tradition. This is my Catholic social tradition capstone project, in which I went to the Sparta Health Center in Sparta, Michigan, and interviewed the staff. This clinic serves the underserved of a rural area of Michigan, north of Grand Rapids, and they also serve the migrant farm worker population of the area. So I wanted to know why they serve this population, what kind of barriers they see that their patients face, what kind of cultural knowledge they'd gained from working with the Latino population, things like that. These insights were really interesting to me because I'm hoping to become a doctor who works with underserved Latino patients in the future, and so gaining insight from a clinic that already does what I hope to someday do was really valuable. I originally got to know the staff at the Sparta Health Center because I did an SSLP there and was able to spend the summer learning from the staff and working with them, and I knew they had a lot of insight to share, and so I asked them if I could come back. Just to give you a little bit of background, Sparta is a rural community about 30 minutes north of Grand Rapids, Michigan, and it's an area surrounded by apple orchards and strawberry and blueberry and all kinds of fruit. And so during the summer months, it attracts a large migrant population. The Sparta Health Center is affiliated with Mercy Health St. Mary's, which is the hospital in downtown Grand Rapids that works with all patients but also has a special mission to serve the poor. Both the mission of the hospital and the mission of the people working at the Sparta Health Center made my job really easy because even though they may not speak specifically about Catholic social teaching, I see a lot of the values and a lot of their comments as very in tune with caring for the underserved. For me, Catholic social tradition is really what brings together the academics and the heart of my studies. I hope to be a doctor, and I hope that this video shows a little bit of how I hope to use my Catholic faith and my own interests and skills to serve. I'd like to say a special thank you to Dr. Schneider and the rest of the staff at the Sparta Health Center. I really appreciate your willingness to welcome me back and to share your insights and skills. Gracias por todo. So what does Catholic social tradition have to say about healthcare for migrants? I used two Catholic social tradition documents released by the United States Conference of Catholic Bishops, Strangers No Longer, which talks about migration, and Ethical and Religious Directives for Catholic Healthcare Services, which is about healthcare. Here's what they had to share. 1. Persons have the right to find opportunities in their homeland. 2. Persons have the right to migrate to support themselves and their families. 3. Sovereign nations have the right to control their borders. 4. Refugees and asylum seekers should be afforded protection. 5. The human dignity and human rights of undocumented migrants should be respected. In accord with its mission, Catholic healthcare should distinguish itself by service to and advocacy for those whose special condition puts them at the margins of our society and makes them particularly vulnerable to discrimination. The poor, the uninsured and the underinsured, children and the unborn, single parents, the elderly, those with incurable diseases and chemical dependencies, racial minorities, immigrants, and refugees.
My name is Jack Schneider. I'm a family physician here. I've been here for 22 years now.
My name is Gary Detweiler, and I'm a physician assistant here. I've been here for almost 18 years now.
Hi, I'm Amy Burling. I'm a physician assistant at Sparta Health Center. Been here for almost 9 years now.
My name is Cynthia Hymas. My title is Client Service Coordinator. Basically, my job is to make sure that if people need something, trying to figure out, okay, where can I find the resource to assist them.
My name is Lily. I'm one of the nurses at Sparta Health Center.
We work with a variety of populations, I guess. We work with migrant and seasonal farm workers, most of whom are Hispanic and Spanish speaking, mostly from Mexico, but some other Central American countries at times as well. We also work with our resident population, which includes farmers, other insured patients, uninsured patients, Medicaid, Medicare. It's a variety.
Went to school at the University of Notre Dame and was a pre-med. Instead of going right on to medical school, I decided I would do some sort of service work. Fortunately at the time, they offered a program called the Holy Cross Associates. They offered a 2-year program in Chile, and I applied and I was accepted for that. When I came back to the States, and I went to Virginia Commonwealth University Medical School, and I got to know a lot of patients who spoke Spanish. There were very few people in the hospital at the time that spoke Spanish, particularly providers. And I realized, again, dealing with a lot of people, they really weren't sure what was going on. They kind of had an idea, but they certainly weren't able to participate with their own care, and certainly weren't able to get the kind of education that we would hope for if we had some sort of illness to help us get better or to help prevent a relapse or help us to just be healthy in general. So that kind of led me to want to work at a place like this once I got through my residency.
Well, I first was exposed to this work in this specific clinic after I graduated from undergrad. I had a degree in Spanish and worked with the Women, Infants, and Children Nutrition Program here, translating, and was exposed to the concept of physician assistants and decided I wanted to go back to school to pursue that.
My first rotation in PA was here in Sparta. Gary was my preceptor, and it was a 2-month family practice rotation. And like if you would have asked me before when I was in school what I wanted to do, I would have totally told you I was going to specialize and stuff like that. And then when I got here and I was doing it for a little while, I just kind of felt like this was like a calling, like a niche for me, and I just felt like, no, this is it. This is what I want to do.
Well, we're just talking about, years back I was a patient here as well.
Okay.
So, I was involved with Telamon, the, Migrant Head Start. And that's how I actually got to know some of the staff, from when I was, working with them. Also just, knowing that, I could make a difference too, because sometimes it's really difficult for them to find access where they can, be able to talk, and, be able to express themselves in the, in their primary language. So I know that.
I was a migrant farm worker myself, so we migrated back and forth 14 years. The reason I got interested in working for a health center is I started off working for migrant health promotion, and basically it was here in Michigan and in Florida, but It was a program where you were still a migrant farm worker, you still worked out in the fields, but you had this other, it was kind of like they would pay you a stipend, so it wasn't a whole lot, but to educate yourself a little bit more and talk to people out in your community. So I really loved that.
Diabetes, chronic pain issues, uh, number of addiction problems, stuff like that. And like I said before, I enjoy seeing pregnant women, and with the corresponding increase in obesity levels and diabetes levels, there are more complicated pregnancies these days than there were even 15 or 20 years ago. I mean, it's just a fact. And so that's made things a little more difficult. But it's kind of a lot of the same diseases a lot of our Caucasians would have. However, it's at a much higher rate, particularly diabetes in the Hispanic population.
Well, language is an obvious one. Not so much with our particular office. Most of us here speak Spanish and English, but if we want to send them to a specialist or if they need to get care through an urgent care, emergency department, that type of thing, I do think that has improved considerably, but it still is definitely a barrier, and it's still one of the reasons that patients will come from an hour or more away to come to this office.
Obtaining preventive health care services for people who live way out here or people who have insurance is also really difficult, and even with people who have insurance, it's there's no bus that comes up here, and it's a little bit of a hike for people to go down there. We talked to a young lady yesterday, and she wanted to have her go have a mammogram, and to her Grand Rapids seems a long way away because she doesn't have a car and there's no bus, and it's like her friend was with her, she didn't have a car either, and they're like, well, maybe we can get somebody to do it, but it's just barriers that you see just because we're in a rural area. The other is just financial. A lot of people are here illegally and don't qualify for some of the health insurance products. Fortunately, through the government, we get a grant to help take care of the migrant farm workers that come here. And that helps. It doesn't cover hospital bills, it doesn't cover a lot of medications or anything like that, but certainly it's better than nothing. It kind of gives them a medical home that we can again help sort out some of these things, and frankly probably prevents a lot of emergency room visits and hopefully a lot of hospital admissions because we're available.
So I see like barriers, the transportation, trying to get health insurance, but you really can't because, of the documentation with the language barriers depending on the state and trying to figure out where to go to get assistance and where's the nearest, clinic. I just had somebody today where they had set up an appointment because they were diabetic and they were out of their medications, but the grower, the farmer, is like, we have to leave and we have to leave now because we've got to get him to the other side of the state. Where can he find a migrant health clinic, in Adrian where we're going? So trying to get that. So that's what I did, find out, okay, this is the address, this is the phone number, and this is the services that they offer there. In Michigan, there's a Medicaid program, and in Florida, they have a different Medicaid program. And so when you move to state, you have to close your case, open your case, and things like that. So, yeah, it doesn't move with you.
So, potentially someone would have to open 2 cases every year and close 2 cases every year if they're going
or
back
more.
and forth. Or
yeah,
more.
Because,
if
people
they are more than 2 states.
And a lot of people do, like, they really do migrate more. If you migrate to 2 states, it's, consider yourself blessed. It's difficult because being a migrant farm worker and just moving around, you're never sure of exactly where you're going to be regarding, housing, work, if there's, when work starts, when you get there. So we found it difficult when you're a migrant farm worker. If it rains, you didn't work, and so there was, no money that day. So, and it's like, if you got sick and couldn't go to work, it was There was no money that day. We're really touchy-feely. I mean, we like it, you know, when you know, say hi to our kids and, you know, just, oh, you know, just even if you just tap them or whatever. We like it when, of course, you speak Spanish. So that's really helpful. And then just feeling comfortable to be you. And I think that that's what we like the most.
A lot of my patients, again, is a culture or whatever, but you know, enthusiasm I think is very helpful. I think the other thing is just to have you know, some understanding about you know, like I said, diabetes, you know, dietary habits. I find they're quite a bit more religious in a lot of ways than a lot of our Caucasian patients. There is a big emphasis on what you said, family, and I think it does make it harder. A lot of our family families that come here are away from their extended families. And I do think that puts a little bit more pressure on people when things are not going well. They expect what everybody else wants. They want you to care. They want you to try hard to help them. And frankly, they need, you know, somebody to give them a little boost, either to do what they need to be doing to take care of their health, or just a boost to say, you know, you're okay. Life is tough. You know, God loves you. I want to do my best, and I want to make sure you get the attention that you deserve. Here, you know, treat everybody individually. That's what they deserve. I'll be honest, I think there's a lot more difference in my population between the well-off Caucasian patients I may see that come from the city and the rural Caucasian whites here than there is between the Caucasian whites here and the Hispanics. I think there's a smaller bridge culturally because they're dealing with a lot of the same issues in terms of finances and jobs and stuff like that. So
I think the big thing is talk to patients, get an idea of what their healthcare beliefs are. For example, we have a lot of patients who bring their children in because their children are grinding their teeth at night, and I learned that oftentimes to them means that the child might have intestinal parasites or something like that.
Okay.
And so again, it's going to vary from group to group that you work with, but I think getting to know the group of patients that you work with and what their beliefs are regarding healthcare can help you address some of these concerns, because if you don't know what it is that they're actually concerned about and they're telling you symptoms, you may never actually get to the bottom of what it is that concerns them.
A lot of times they also will schedule themselves for a physical because they know something's wrong. They have some whatever symptoms, but for whatever reason they don't quite understand that you know, there's a difference between like a problem focused visit and a physical, because they just figure a physical is general, and you know, to me, I'd rather do a problem focused visit because, you know, I mean, the type of exam, the type of questions you're going to ask and stuff is different for, like, you know, say somebody is feeling tired all the time. Let's do something generic like that, you know. And so they've been feeling really tired all the time, so they just come in for their physical, and I'm like, you know, when I ask them if they have any problems and they start going off on whatever, or their knee pain or whatever, and I'm like, all right, we're gonna need, this is not really a physical. I'm like, how about we talk about your knee pain or your tiredness or whatever it is that you wanted, you know, to know. And I'm like, we can worry about your colonoscopy and your mammogram and your pap smear at a later date, because you don't, you know, that's not really what you're here for.
I was telling Gary about about how we don't, you know, eat things that are super hot because we think we're gonna get that diarrhea, you know, because this is really hot. You gotta wait till it cools down just a little bit. So just these things that we have, you know, that are in our culture.
I think there's been some improvement. Fortunately, working for St. Mary's, or what is now Mercy Health, has always been a big advantage for us because they've done an excellent job of providing care for patients that are uninsured, maybe have emergency Medicaid or straight Medicaid. So I think that's always helped us to provide care for these patients, but I do think there's also been an improvement as far as insurance, access to insurance with Obamacare.
I feel that a lot of the people that didn't have insurance now have insurance, and have that access now. There was a lot of in Michigan before the whole marketplace. Obamacare is what they call it. Before that, it's like if you weren't disabled, pregnant, or had kids, basically you couldn't get Medicaid.
It's helped to increase the amount of people who have coverage. The good thing about the expansion of the health insurance has been that we cover a lot of people we didn't used to, and that's fantastic. The bad part is that they really didn't kind of pay attention to the fact that there are very few primary care doctors. So it's hard for them to find one, and we have people that drive a long way to see us, and frankly we have way too many patients. Any good family physician, just by the nature of our work, is going to do education in terms of working with people to help them make better health choices, identify risk factors that can make them at risk for any number of medical problems, obesity and diabetes, smoking and COPD, lung cancer. The list is quite long with those things. And so, when I sit down with people, number one, it makes them comfortable because even though they may do the vast majority of their day-to-day activities in English, and frankly, a lot of my patients speak pretty darn good English, and a lot of times I don't even know that till, I have a lady in labor, and she'll show up, and the nurse will say, well, her English is perfect. And I'm like, okay.
But I talked to her in Spanish.
Exactly right. And what it is that they just feel comfortable. It's always our job as providers and clinicians to adjust what we say, what we do in terms of interventions based on somebody's educational level, having some cultural sensitivity, and also kind of understanding just people's preferences. Some folks are just they really need a lot of hand-holding. Other people are just like, please leave me alone. All right, we'll just quit smoking. And you really have to make it very simple and be very direct and not expect them to want a whole lot from you. So you got to individualize just to be able to kind of connect to. If I told somebody not to eat carbs, that's kind of tough. Your diabetes is really suffering because you're eating too much carbs. Well, you have to bring up tortillas and things like that because that's very cultural and kind of just identify with what the diets people are on. But
so I always write my patient plans in Spanish so that if they don't remember what it was I told them when they were in the office, they can consult that piece of paper. Hispanic women in particular like to have their pap smear every year.
Okay.
That's an education piece that we tell people, you really don't need that every year. But you get people who'll come in every year and be like, I want my pap smear, I want my pap smear. We had one last year and it was fine. You don't really need one of those again. And they're like, really? Yeah, it's okay.
In addition to the Sparta Health Center, there's another organization in Sparta, right across the street from the health center actually, that provides insurance for the migrant population. This organization is called Intercare, and in addition to offering the insurance programs for migrants, it also offers outreach to the migrant farm worker camps. When Dr. Schneider and Cynthia refer to outreach, they're referring to Intercare. Cynthia also volunteers with Intercare, or works with Intercare, and when I was in Sparta for the summer, I also participated in outreach. So these two organizations work very closely together in order to provide migrants with whatever care they need.
We go to all the different camps in the area. There's probably like more than 100 here. And yeah, we go door to door and like I said, give them information, and also we have a nurse and she goes out and does blood pressures and glucose and tries to answer questions as much as she can. And what I like about here in Michigan and where we're at here in Sparta and all through Southwest Michigan with Intercare, that's one of the things when we go out into the community, out to the camps, and make sure that people have information, where we're at, where we're located, what's the procedure, what's the process, what can we help you with. So doing outreach and getting out there and, informing people of health and healthcare and where to get it, I think is really like a plus. So, yeah. And finding people that don't go to the doctor because, they're just like, well, I don't have any money, I don't have any health insurance. And then we're out there doing outreach and, a nurse is checking a blood pressure and, blood pressure is high, and then, check it again and, again. And so trying to get that person, hey, you have high blood pressure. Or even, when they do the diabetes check, the glucose, so.
So, I mean, they're definitely really helpful, and it's great when, like say I have somebody with high blood pressure or whatever, and they are not necessarily able to check their blood pressure, and I can send a nurse out there when they go, they go to their camp and stuff, and I can say, check so-and-so's blood pressure because it was high here in the office, that kind of stuff. And they also occasionally they'll identify a new diabetic or a new person with high blood pressure who didn't know they had it, and then they can, communicate that to us and send them into the clinic and say, hey, check this out, there's something wrong with this person. So I think that in that terms it's very helpful.
I mean, I think I'm pretty fortunate I found my vocation.
It's been very rewarding work. I don't think I would have been here for almost 18 years if it wasn't. It can be, the barriers can be frustrating sometimes as far as patients not being able to get medications that we feel they could really benefit from, or maybe not being able to get in to see a specialist we'd like them to see. But overall, I think it's very rewarding. I think that the majority of our patients are extremely appreciative for the care that they do get, and I haven't found anything else I'd rather do at this point.
It's because I had the experience. I was a farm worker. I did the work. I was out there wet and, rainy and cold and, freezing hands because the asparagus was so cold. So the experience to actually experience it, it hits you in your heart because you've been there, you've done it. And so it makes me like understand more and have this compassion, because it's hard, they do a lot of hard work. It's hard work. It's really hard work.
Yeah.
And so I appreciate, and the reason I feel that I work here too is because I was there, know what it's like, went through the struggles, and now I can empower and help other people try to be better, and I've been blessed to have that opportunity to give back to the community. So I really thank God that I even had the opportunity to do it, because it's been rewarding. Like, I like what I do. I actually love what I do, and I actually tell people that I love what I do, because Mercy Health is, a Catholic organization, and they really, put that into you, the mission of the hospital, and it's so cool because the mission is actually to serve, the underserved and to help, and so that's an extra bonus, that working for an organization that really believes in helping everybody